Hello everyone, we're delighted to introduce you to Dentospedia, the premier and most comprehensive platform specifically designed to help you excel in your dental board exams. So today I'm going to teach you a short topic on indirect pulp capping from the module of Pediatric Dentistry. So let's begin with the topic. Indirect pulp capping (IPC) is a procedure performed on a tooth with a deep carious lesion that are close to the pulp. Understand? But have no signs of irreversible pulpitis. The goal of IPC is to preserve the vitality of the dental pulp and allow the tooth to naturally heal by encouraging the formation of a new and protect the dentine. Understand? Now see, the core principle is that the deepest layer of the carious dentine, which is hard or leathery, is often affected or demineralized, but not infected. Understand? Removing this final layer risks accidental exposure of a healthy pulp. So it is indicated when the patient has a deep carious lesion. Understand? It is indicated when the patient has a deep carious lesion. And the patient has a deep carious lesion when the tooth is asymptomatic or only exhibits reversible pulpitis. Understand? The tooth is asymptomatic and exhibits reversible pulpitis. Radiographically, the lesion appears to be close to the pulp chamber. There are no clinical signs of pulp necrosis or irreversible pulpitis. Are you getting the point? Yes. So there are no clinical signs of pulp necrosis or irreversible pulpitis or any type of abscess, swelling or continuous nocturnal pain or widening of the PDL space on the X-ray. Understand? So these are the ideal case selection for indirect pulp capping. So see, next is materials used in IPC. So calcium hydroxide or MTA biodentine is used as a protective base to stimulate dentine bridge. Glass ionomer cement seals and bonds over the liner. Now composite resin or stainless steel crown is the final restoration depending on the tooth type. Disinfectant example chlorhexidine is used as a cavity disinfection before the liner is placed. So these are the materials which is required for indirect pulp capping. Now see step-by-step procedure for indirect pulp capping. How this procedure is being done. So see, first is diagnosis and case selection. Now you have to confirm the tooth vitality. You have to take patient's history. You have to percuss the tooth. You have to see if tenderness on percussion is present or not. You have to do thermal test if applicable. Now you have to take various radiographs like periapical, biting radiograph to assess the lesion depth and periapical status. Understand? Now then you have to administer local anesthesia and you have to maintain proper isolation. Understand? It is very important. You have to isolate the tooth with cotton rolls or rubber dam for optimal moisture control. Understand? Now see, caries removal. Caries removal. See, the dentist removes all the soft, infected or peripheral decay. The deepest layer of dentine directly over the pulp is left in place, which is the affected dentine. Which is the affected dentine. So, the affected dentine is left in the place even if it is discolored, provided it is a hard or leathery. Understand? Now, cavity disinfection. Cavity disinfection. Now, use 2% chlorhexidine or sodium hypochlorite to disinfect the cavity. Now, gently dry with cotton pallet. Understand? Then you have to place the biocompatible liner. A protective or therapeutic material is placed over the remaining dentine. So, the most common used materials are calcium hydroxide, MTA, or biodentine on the deepest area of the dentine. Placement of a biocompatible liner is a protective and a therapeutic material that is placed over the remaining dentine. Now, historically, calcium hydroxide is used for its high pH, which is believed to stimulate tertiary or reparative dentine. Now, MTA or mineral trioxide aggregate is a newer material offering superior sealing and bioactivity for reparative dentine formation. Understand? Then you have to seal it with the base. You have to cover the liner with a resin modified GIC or RMGIC or conventional GIC. Now it will prevent micro leakage and will provide a good bonding surface. Now you have to do a final restoration. Now the remaining cavity is sealed with a definitive strong restoration. Understand? Like composite or stainless steel crown to ensure a tight seal that prevents bacteria from penetrating and infecting the pulp. Then you have to do follow-up and evaluation. Understand? You have to reevaluate clinically and radiographically at 6 weeks. So you have to check for symptoms and radiographic stability on 3 months, 6 months, and 12 months. See, you have to check for these type of symptoms, like there should be no symptoms. Understand? Now you have to check for continued root development if the tooth is immature. Understand? You have to see that there is no radiographic signs of pathology in the radiographs, and there is the formation of a tertiary or a reparative dentine. Are you getting the point? So you have to check for all these points, as these are the signs of success in the case of IPC. You can see removing the caries with a slow speed burn. Then these are the 3 layers: necrotic tissue, leathery infected dentine, and affected dentine. You can see this is a necrotic tissue, this is a leathery infected dentine, and this is a affected dentine. Understand? Then placing of calcium hydroxide over the carious dentine. You can see here. Now final restoration is being placed. This is a procedure for indirect pulp capping. You can see the advantages. It prevents pulp exposure. It promotes pulp healing. It is minimally invasive, cost effective, and the success rate is high. Understand? It also minimizes the risk of irreversible damage, and it stimulates the tertiary dentine bridge formation and also preserves the pulp. Now, some of the disadvantages, like it requires accurate diagnosis. Understand? If you misjudge the pulp status, so it can lead to failure. Now, risk of bacterial entrapment can be there if not properly sealed. Now, it is also technique sensitive and it requires regular follow-up. So, healing must be monitored radiographically. Understand? So this was indirect pulp capping. So for detailed video, please download the app Dentospedia, and please do like, share and subscribe our Dentospedia channel. Thank you very much.